and this is Amina.
Hi.
And we're both research officers at the Australian Indigenous Health Infonet, and we also work on the Australian Indigenous Alcohol and Other Drugs Knowledge Centre project. Thank you everyone for joining us in today's webinar. So today basically what we're going to do is introduce you to the Knowledge Centre website, provide an overview of the kinds of information that you can find on our website, look at some of the specific sections of the website, and demonstrate how to find resources that you can use to support you in your work. So as we'll be demonstrating the website live, we'd encourage you to follow along with us, and we'd also ask that if you have any questions, if you could please hold them until the end and we'll address those. So we should have about 15 minutes at the end to answer any questions that you might have. So we're just going to switch off the webcam now, so you won't be able to see us anymore, and we'll head over to the live site. So everyone should be able to see the Knowledge Centre website on their screen now. Can everyone see that?
Excellent.
Excellent, that's great. Okay, so the Knowledge Centre is an online resource managed by the Health Infonet and funded by the Department of Health. It provides evidence-based, culturally appropriate information on alcohol and other drugs for people who are working or interested in reducing the harms from alcohol and other drugs in Aboriginal and Torres Strait Islander communities. So on the homepage of the Knowledge Centre website, you can find specific topic information on tobacco, alcohol, illicit drugs, prescription drugs, and volatile substances. So now I'm going to hand over to Avina, who will start to explore the website more in depth for you.
Good morning everyone and welcome. So firstly we're going to have a look at one of the topic sections. As you can see across the black tabs across the top of the website there's alcohol. So if you're following along, click onto alcohol at the top and that should bring up the alcohol homepage. This is an example of each of these topic areas are set out. And this homepage here has all of the other key topic sections we'll cover, and they'll look the same for ease of navigation. Firstly, we're going to have a look at policies and strategies. If you're scrolling down, you can see there's the policy section. We actually have this collection of national and state policies, including the related publications, and they're categorised as Indigenous specific or general. If we click on the heading, Indigenous States and Territories, and then click on Policies, you can see we have a list of policies there. You can sort these according to the year via the clickable buttons at the top of the page. Clicking on the alcohol button on the left-hand side of the page will take you back to the home page of the alcohol section, and we'll move on now to demonstrating publications. So under the publications section, you will find a list of publications which address alcohol use among Aboriginal and Torres Strait Islander people. These are divided into general and specific topics, and they include articles, reports, and other literature. We have further categorised the alcohol publications by prevalence, health impacts, social impacts, prevention and treatment, and regulation and control. For an example, if we click on the prevention and treatment category, like the policies, you can see that they've been presented by the year, which you can change via the clickable tabs at the top of the page. Now we'll go back to the alcohol homepage and show you health promotion resources. Health promotion resources in this section are listed on alcohol relevant to Aboriginal and Torres Strait Islander people. Clicking here on the home page will take you directly to a list of resources which is sorted alphabetically and includes content such as leaflets, posters, audio visuals like videos, comics and more. You can change the way these are sorted at the top via the title, the year, the author, and type tabs across the top. Here's an example of what a health promotion resource entry looks like. We're going to click on Staying Strong, Drugs and Alcohol. All of our health promotion entries will have an abstract, contact details, and a link to the resource and any further information. Going back to the home page, we'll now move on to health practice resources. We collate health practice resources and further categorise these into drinking guidelines, regular guidelines, toolkits, manuals and other resources. Let's look at what we have under guidelines. You can see that these are listed in a similar way to the health promotion resources. However, note that these are sorted to display by the most recent publications first, rather than alphabetically. They can also be sorted by headings in the same way as the health promotion resources by clicking on the tabs at the top, like title, year, author and type. Let's look at an example of a guideline. The guidelines on the management of co-occurring alcohol and other drug and mental health conditions in alcohol and other drug treatment settings. So as you can see, like our health promotion resources, you'll have a description, contact details and links. The next section we're going to have a look at is the program and project section. This section is a collation of programs that address alcohol use among Aboriginal and Torres Strait Islander people. As you can see from the home page of the portal, these can be further sorted by the categories of education, supply reduction, treatment and support, diversion, research and young people. If we click on the Education tab, you will see a list of programs sorted alphabetically. Here's an example of what a program entry looks like. We're going to have a look at Articulation. Each program entry will have an abstract explaining the aims, processes and any outcomes of the projects, as well as who to get in touch with for further information, and some links directing you to additional information. If we go back to the home page, we'll now show you the organisation section. So the Knowledge Centre also lists a collection of organisations who are addressing issues related to alcohol use among Aboriginal and Torres Strait Islander people. These are listed alphabetically and can be sorted by the name, the status, reach and focus. For an example, we're going to have a look at Aboriginal Drug and Alcohol Council, AODAC. Like our other entries, there's an abstract and also some contact details. You'll notice that there's also a related program section, which links to programs that the organisation has run or been involved with that are currently listed on our site. So going back to the alcohol page, we'll now show you the workforce section. Each section also has this workforce section which provides information about courses, conferences and events, job and funding opportunities that are relevant to that topic. This section is particularly useful for the workforce. If we look at an example of courses under the workforce, you can see it looks similar to the other sections and can be sorted in the same way by the headings across the top. For an example, we're going to choose 14-hour Aboriginal and Torres Strait Islander Mental Health First Aid Instructor course. Here's an example of what the entry looks like. It will provide an overview of the course, who it's intended for, and financial information, as well as contacts and links. Now we're going to have a look at the news section. You can see on the right-hand side you can access many of our social media platforms, and the news is down on the right-hand side. This is a collection of the latest news that we can find for alcohol use issues that might be relevant to Aboriginal and Torres Strait Islander people. If you click on the alcohol news, a list of the most recent news comes up. Each topic section has a dedicated news feature, which is a good way to stay up to date with the latest news from the sector. I'll now hand you over to Millie, who will talk about a section that is particularly relevant to alcohol, our Fetal Alcohol Spectrum Disorder portal.
Hi again everyone. So our FASD section, which you might have noticed before, is located under the alcohol tab in the black tabs across the top of the page. So we'll just click on that and go to the FASD portal. FASD is an area of concern that has come to prominence in recent years, culminating in the Commonwealth FASD Action Plan 2013-14 to 2016-17 and the release in 2014 of the National Strategy to Tackle Fetal Alcohol Spectrum Disorder. The Knowledge Centre showcases a central collection of resources and training materials for AOD health practitioners for the prevention and management of FASD in Aboriginal and Torres Strait Islander communities. The FASD portal is set out in the same way as our other topic-specific areas and includes information on news on the right-hand side here, programs and projects over here, policies and strategies up the top there, publications, workforce, organisations, and health promotion and health practice resources. However, additionally, FASD has a key facts section which provides topical information about the subject, including diagnosis, alcohol and breastfeeding, preventing FASD and more. The FASD key facts are a good introduction or refresher for people who haven't had much contact in this area. So just scrolling down here, you can see there's quite a bit of information. So that's it, all the content that we currently have under this alcohol tab here, but obviously there's a lot in there, so we'd encourage you to go on there and have a look at it in your own time. So if we go back to the home page now, you can see that there. We'd like to demonstrate a key feature of the AOD Knowledge Centre, which is our bibliography. This is a searchable database of literature about Aboriginal and Torres Strait Islander health and substance use. This collection contains over 3,000 items and draws from a range of sources, both scholarly peer-reviewed journals and grey literature such as government reports. You can search the database for publications on all aspects of substance use under the Bibliography tab for general publications. So if we wanted to search a topic, for example, we could just search for tobacco. We'll enter that there, hit submit, and then we'll bring up the bibliography search results there. And as you can see, there are a couple of results and they are sorted by year. And if you wanted to scroll down, you can see them and then hit next for the next page. Obviously, there's a lot more search options and you can refine this search further. So we'd encourage you again to have a look at this in your own time. So going back to the home page, we'd now like to guide you through the workers portal we've developed, which you can access via this quick access button up the top of the page, and it's just there, or you can scroll down a little bit and it's just there under the portal section. So the workers portal is a plain language portal designed for AOD workers. The portal was created in partnership with the University of Sydney's Substance Misuse Program, and material for the portal is largely based on their handbook for Aboriginal alcohol and other drug work, which you can see on the right hand side there. The portal provides information on 16 different topics, ranging from information on specific drug types, which you can see here, such as cannabis or amphetamines, mental health and substance use down the bottom there, reducing harms from alcohol and other drug use, which is just there, and working with specific groups such as pregnant women or young people, which is located in special situations, settings and groups. We won't have time to go into all the topic sections today, but we'll use the example of the topic amphetamines and cocaine to show you how the workers portal looks. So we'll just click into that. So this is the homepage of the amphetamines and cocaine portal on the AOD workers portal. These sections are similar in layout to other topic sections we've seen on the Knowledge Centre, but the content in each of these is different in that it's tailored specifically for workers. A section that workers might find particularly useful is the Tips for Workers section. So each of these topics has a specific Tips for Workers, which was developed to provide plain language practice guidelines for AOD workers. In this Tips for Workers section, specifically on amphetamines and cocaine, you can find information about how stimulants affect the body, how to recognise the harms from stimulants, how to recognise stimulant dependence, how to help a person who uses stimulants, and stimulant overdose and more. So each of those sections has one of these, which obviously has quite a lot of information in there. However, each of the sections is tailored slightly differently depending on the topic, so I'd encourage you to go and have a look at that in your own time. So if we just go back to the workers portal now, other sections that you might like to look at is the general principles section. This section has tips for workers, if we click on that there, on things such as how to approach doing an assessment with a client, this one here, using strategies such as brief intervention, and information on counselling and case management as well. To read more on a topic, you can also click on these hyperlinks here, and what this will do is download the relevant chapter from the handbook that I mentioned before. So now if we go back to the AOD Workers portal again, another key feature of the Workers portal is the section on taking care of yourself down the bottom here. This was developed on resources developed by NCEDA, which is one of our partners. These resources were developed in recognition of the challenges faced by those working in this sector. And if we click on the Tips for Workers section, you'll see that this provides information which is aimed at helping reduce worker burnout and stress and increase worker well-being. And there's also a collection of health promotion and health practice resources that are related to this area. So one last additional section that we'd like to talk about, which is particularly relevant to the workforce but not located in our AOD Workers portal, is the section on workforce development, and you can access this on the right hand side of the top there on our banner. So you just click on workforce development. So this section has also been developed in collaboration with NCEDA, and it aims to provide information about the Indigenous AOD workforce, including information on the particular issues and challenges facing the Indigenous AOD workforce, and ways of enhancing the capacity of AOD workers. There are also links here to NCEDA-produced publications, which aim to support workforce development. And you can see these a little bit further down the same page here. Say, for example, this one here, Feeling Deadly, Working Deadly Resource Kit. You can also find a collection of health promotion and health practice resources in this section, and they are, so if we click to workforce welfare, you can see there's health promotion resources there, and they are sorted very similar to the way that you see our other health promotion resources section, and again you can sort by the clickable headings up the top. So for an example, we could look at this one, ICE in the workplace, and as you can see, it's very similar to the way that our other sections are laid out. So like the other sections of the Knowledge Centre, the Workforce section also has a page on policies and strategies that are particular to the workforce, and you can access this on the left-hand side. We won't go into that one because, like I said before, it's very similar to the way our other pages are laid out. So that's it for the Workers portal and the Workforce Development sections. And I'll now hand over to Lavina, who will talk to you about the community portal that we've developed.
So to access the community portal, you can use the Quick Access tab at the top, or you can scroll down and access it from the portal section. We have a disclaimer whether you would like to hide or show images. Today we're going to show the images. So the community portal was developed in consultation with Indigenous people across Australia, and we did a national survey as well as several focus groups to find out what sort of information people in the community wanted about alcohol and other drugs. So the community portal is designed for Aboriginal and Torres Strait Islander elders and community members who are working to reduce the harms caused by alcohol and other drugs in their communities. It includes plain language fact sheets on alcohol and other drugs, and you can see the tabs on the right hand side there. Information on what communities can do to reduce harms from alcohol and drugs, where to go for help for families, young people and offenders, as well as a section on social, emotional and cultural well-being. If you click on the alcohol and other drugs fact sheets on the right hand side of the page, you can access a series of plain language fact sheets produced by the Knowledge Centre to provide a brief overview of alcohol, cannabis or ganja, ice, kava, prescription drugs, petrol paint and other inhalants, and tobacco. Each fact sheet is available as an HTML or as a downloadable PDF. Let's take a look at the fact sheet for petrol paint and other inhalants. Each fact sheet contains information about the substance itself, how people use it, immediate effects, long-term effects, withdrawal and population groups, for example, pregnant women, as well as information relevant for that topic, That is, for this fact sheet, it includes information on sudden sniffing death. So if we go back to the home page, we'll show you a key part of the community portal, which is the different pages we provide to give information about help for specific population groups who might be struggling with substance use. We'll take a look at an example of how these pages look. Each of them varies a little bit depending on what topic they're covering, but they'll aim to provide information about helping that population group with their alcohol and other drug use. As an example, we'll click on Help for Offenders. And as you can see, we provide information about court diversion programs, entering prison, transitioning back to the community, and organisations. Up the top of the page, there's also a list of programs that are running to provide people in contact with the criminal justice system assistance with their alcohol or other drug use. Like the other programs pages, these can be sorted by title, reach or focus, and the entry itself looks exactly the same as the ones we demonstrated earlier. As an example, we're having a look at the Aboriginal Prisoners and Offenders Support Services. One last feature of the community portal that we'd like to show you today is the video section, which you can access on the menu on the right-hand side of the page. This is an extensive collection of health promotion videos on different topics such as alcohol, cannabis, and injecting drug use. You can sort by topic on the clickable buttons on the top, for example, ICE. And that's it for the community portal. As with all the other topic areas, we'd encourage you to get on and have a look at all the content in your own time. And that's it for the community portal. I'd like to hand over to Millie, who will talk to you about the Tackling Indigenous Smoking, or TIS portal, and some other key sections of the Knowledge Centre.
So in addition to the tobacco sections of the Knowledge Centre, we also have a portal that has been developed specifically to support workers and organisations funded under the Tackling Indigenous Smoking program. You can access this portal in the tobacco heading, just there, via the quick access menu at the top of the page, or again under the portal section on the home page. So the portal is a central hub for all information that TIS workers might need to carry out successful activities to tackle smoking in their communities. It provides a location for evidence-based information relating to tobacco cessation, with a focus on local needs and locally designed approaches. So the TIS portal includes resources to support best practice in tobacco cessation, which is just there. These include resources to support planning, implementing and evaluating TIS activities. Workforce information such as training opportunities and workshops, and information on programs that have been evaluated, as well as a range of social media platforms which you can see at the top right here. They're to encourage networking and sharing of information. We won't have time today to go into all the information available on the TIS portal, but if this is relevant to your area of work, we invite you to explore the content as it is useful to both TIS workers and to anyone else working in the area of tobacco control. So if we go back to the homepage now, we'd like to show you one of our key products we produce, which is our topic-specific reviews, which you can access on the homepage just here. We currently have reviews that cover alcohol, illicit drug use, kava, and volatile substance use. The illicit drug use and the volatile substance use reviews are our most recent publications, as they were both published this year in 2016. So if we look at our review of illicit drug use, these reviews are basically a synthesis of all key information on that topic area, bringing together current evidence and information into a comprehensive document. We provide also plain language versions of these reviews, and these can be accessed on the left-hand side here. So if we click into that, you can see that there's the plain language review, and these are a little bit more accessible and easy to read. Both our plain language and our regular reviews are also available as PDFs, which you can download and save for reading later on. We've also been working on developing our reviews into ebooks, which provide a more interactive way of reading and engaging with the content. So our first ebook is the ebook that we've done on volatile substance use, and if we click on this part of the homepage here, you can see information about how to download and read the ebook, and these are all free to download from the Apple Store. So lastly, going back to the homepage, we also provide a phone app, AODconnect, and you can find information about how to download and use it again on our homepage just here. So AODconnect is basically a national directory of treatment services for Aboriginal and Torres Strait Islander people for alcohol and other drug use. It has been designed for health professionals in the AOD sector as a portable means of locating a treatment service. You can access the app even when you have no internet connection, and it will make any updates that we've made when you go back online with an internet connection. The app allows you to find a service by region or state through an interactive map or alphabetical listing of services. You can also find a specific type of treatment by choosing different categories such as withdrawal management, residential rehabilitation, or services for young people. AODconnect is available for both Android and Apple devices, and you can download it for free on the 2 stores. So now I'll hand over to Avina, who will discuss the social media services that we offer as part of the Knowledge Centre, which is the last part of the webinar.
So I'm going to talk to you about our yarning places. So we can access that from the homepage of the Knowledge Centre.
On the homepage, so if we go back to the homepage.
So whenever you want to get back to home, click on the gecko at the top, it'll always take you home. Now the yarning places are on the right hand side of the screen, and you can click to log in. So the Health Infinite established yarning places online networks for people from different states, territories, regions and sectors to share information, knowledge and experiences. We currently host 18 different yarning places which cover a variety of different topics, including one specifically for the AOD Knowledge Centre and one for the TIS portal. So this is the homepage of the yarning places where you can join, you can sign in, and it's on the right hand side of the page there. So we're going to have a look at the AOD Knowledge Centre yarning place, which you can find on the right hand side in the list. Each yarning place has a yarning board, which is similar to a message board where you can post a topic or answer a question in your own time. There's an events tab, basically a listing of events relevant to Aboriginal and Torres Strait Islander alcohol and other drug use. These can be added by the Health Infinite staff or by members if there's something they would like to add. There's a mob members list. This is the list of people who are currently members of that yarning place, and the provision of your details is optional. We have a Yarn Now section similar to a chat room where you can talk to other people in real time, and you can choose to chat in a topic specific room. Please know that all the yarning places are free to join. So that's it for the yarning places. We'd also like to show you our newsletters that are available to sign up for free. You can find the newsletters down at the bottom of the page in the Stay Connected section. So the Knowledge Centre sends out a newsletter each month that focuses on a different area of alcohol or other drug use. And these contain information about what is new on the website, including news, job opportunities, publications, resources and programs. Here's an example of our most recent newsletter for October, where we focused on women's health and AOD use. You can sign up on the page by clicking on the side menu and entering your details. We offer newsletters for a variety of other topics, including nutrition, social and emotional wellbeing, and chronic diseases. And as you can see on the page, you can access the archived newsletters at any time on that page. For other social media, we actually have a lot of Twitter accounts, including an AOD Knowledge Centre Twitter account. This dedicated Twitter account allows you to follow the latest information about alcohol and other drugs, and we have one for the TIS portal as well, so that would be smoking cessation. We post topical and timely information on these accounts which might be relevant to you in your work. That's easy to follow. Okay, so that's it for our presentation part of the webinar today, and we'd like to open up the chat box for anyone who does have any questions. So you can please type them in there and we'll try as they come up, and we'll allow about 10 or 15 minutes.
Hi everyone, any questions? Or is there anything that you might like to look at? So if we go back to the Knowledge Centre, is there a particular area that you would like us to have a quick look at for you?
So if you have any questions, feel free to type in the chat box.
If you don't feel comfortable asking the question right now, that's completely okay as well. If you can see the slide, we've also got our emails there as well in case you'd like to contact us after the webinar. Thanks Susan, that's a lovely comment.
Thank you, Susan. Like we said, if something comes up later, feel free to email us at any time. We're more than happy to help you with any parts of the website or resource.
Yeah. And we'd also like to point out that if you have any information that you'd like to share with us, we're more than happy to host it on the website. So if you do have anything that you think you should be sharing with us or with the community, then please get in touch. So we have a question here from Drug and Alcohol Services SA. How do we ensure that the information is current and accurate? So basically what we do as part of our processes here is we audit all the information on there. So obviously it's quite a time-consuming process, but we do make sure that every year all of the information on there is audited. But obviously there's a lot of content, so sometimes you might find that the links might be broken. And if that's the case, then we'd encourage you to get in touch with us. So there is, if we just switch back to the website now, so you should be able to see the website. If you're on the home page here and you scroll down a little bit, there is a contact us page. So you can just click on that and you can either send your email directly to that email there, aodknowledgecentre@healthinfonet.org.au, or you can put your information in this box here and submit it. So that's a good way of keeping in touch with us to let us know. But we do really appreciate it when people get in touch with us to let us know that the information's out of date, because like I said, we do audit it, but it's a yearly process and it does take us a while because it is quite time consuming. Excellent, thanks Andrew. Yeah, please get in touch with us if you've got any questions or anything you'd like to share. Yep, hi Alison, you wanted to sign up for the newsletter. So if we go back, so this is the Knowledge Centre website here, and if you are on one of our pages, there is a newsletters option, which you can see on the right hand side. It isn't on the home page, but it is on any of our other pages. So you can just click on that, enter in your email address, your name, and whatever topic you'd like to sign up to. Are you having any luck finding it? Excellent, cool. That's good.
Thanks T. Patterson.
That's excellent to know. That will help with your pregnant ladies. If you are also working with pregnant ladies who are smoking, we do actually have a portal that could be especially relevant to you, which is the Preventing Aboriginal Maternal Smoking in WA portal. Obviously it's only relevant to people in Western Australia at the moment, but we are hoping to at some point expand this nationally. But there is also a great amount of information in there, like resources and things that you can use with pregnant women who might like to give up smoking. So that's
Thank you, Jane. Thank you for joining us.
It's also worth noting that we will be hosting a series of webinars, the Knowledge Centre, but what we're hoping to do is to get our national partnership centres. So we've obviously got NCEDA, ENDRI and NDARC. So we will have those 3 national centres presenting for us, and so the next one we have will be Professor Anthony Shakeshaft, and that will be sometime in January. So we're still hoping to confirm the date, but once we do that, we'll send it out on our news section. Alan, yes, this webinar will be on. I'd like to take those down before we finish up today, but if there's no other questions, then we'll be signing off. Thanks everyone for joining us.
Thanks everyone.